Hey y'all, JD Hurst here again with the Bookly Blessed podcast. I had asked my aunt, who was a nurse in the 60s, 70s, 80s, maybe even into the 90s. She was a nurse for quite some time to interview with me for this podcast, and she declined because she doesn't like to be on video, and that's fine. However, she was kind enough to give me a lot of information on nursing during that time frame. Again, this goes back to the new book series that is coming out, starting with Peyton's Pride. That is the first book. That is Adam and Elena's story. And both Adam's mother and Elena are nurses during this story. So it has a lot of pertinence. I just kind of want to read to you her really in depth responses, my aunt's responses, because they're really interesting, and I just thought that y'all might like to hear some of the results of my research that I do to try and make sure that my fictional stories are still accurate as they possibly can be, especially when we're dealing with something historical that has actually happened, like the Vietnam War, and um, something that could actually happen in someone's life, or could have happened back during that time frame. So I'm just going to go ahead and get started. I'm going to read this to you. I'll stop and comment here and there when I really just, wow, thank you, Aunt Patty, for, you know, supplying these great answers. I really appreciate your in-depth um, explanation of everything that you gave me. Thank you very much. I hope that my fans are going to enjoy hearing your nursing story. So I had asked her about nursing uniforms in particular because that is mentioned at points in my book. And she said, when I graduated in 1966, we wore white uniform dresses, white pantyhose, white shoes, and white caps. And I had guessed that just from seeing pictures. My husband's mother was also a nurse for 35 years, but she didn't start nursing until the late 80s, I think. But she has a picture on their wall of her in her nursing uniform, and at that time, she was still wearing the white hat and the white dress and things like that. So, um, I had, like I said, I had guessed that that was the case, but I was so happy to hear my aunt's confirmation of that. So she said, in the 70s, we were allowed to wear white uniform pantsuits. I think it must have been in the 90s that we ditched the hats and wore scrubs. And then I asked her, if there was any familiarity with between the nursing staff and the doctors. Just because, again, based on my mother-in-law's experiences, she had a lot of great relationships in her hospital, across the board, doctors, nurses, even, the patients. A lot of times she knew the people who came into her ward. So that's why I asked my aunt about familiarity in 1970 is when the book is set. And she said, when I was in school, I was called Miss Nielsen. The docs usually called us by our first names. We called them doctor and their last name. Familiarity depended upon the doctor, same with all professions. Familiarity went from steamy affairs, only knew of hospital gossip, aloof and full of themselves, ornery and tense, genuinely nice people. I'm glad most doctors I worked with were genuinely nice people. And then I had asked her about nursing school because Elena actually goes to nursing school after she meets the Paytons. So she said, pretty typical. It seems like it's relatively the same today. 2-year associate degree nursing program, 3-year hospital nursing programs, and a 4-year bachelor degree nursing program. I believe the 2-year associate's degree program developed because of the need for nurses during the Vietnam War. The story is set during the Vietnam War. That's pretty cool. And then I also asked her how a typical shift would look like because, again, in my book, there is mention of a shift, a nursing shift. Uh, and she said, well, it always started with report on the patients given by the previous shift. And I think that was pretty much the same today. My husband has been in the hospital enough times for me to recognize nursing patterns, such as report given by the previous shift. Assignments were given, which patients the nurses would care for, or if the nurse was a medicine nurse or a team leader. Every shift includes vital signs and a nursing assessment of the patient's condition. That's pretty much the same way it is today, too. Um, Duties depended upon the shift. Days, the AM, cares and bathes, breakfast and lunch, ambulation, following the Cardex for standing orders or new orders. I'm going to have to look up what Cardex means. I don't know what that means. Um, may involve treatments, wound care, IVs, various medical equipment, charting. Evening shift, supper trays, um, HS, HS cares. Hours of sleep. May involve more treatments, settling the patients for the night, charting. Night shift, keeping the patients safe at night and attempting to help the patients have a good night's sleep. Every shift involves vital signs and a nursing assessment of the patient's condition. I just described shifts on the medical, surgical, pediatric, and postpartum wards. Those are the wards that she worked in the decades she was a nurse. My aunt. Shifts on the OB labor units, emergency wards, same-day surgery, and operating rooms were quite different. Nurses worked in hospitals, doctors' offices, public health, school nurses, prison nurses, military nurses. Nowadays, there are same-day surgical centers. My husband's been in and out of a lot of those. Uh, Many nurses work there today, but what I had asked her about was where did nurses typically work? I wasn't sure if there was the same kind of medical centers and separate doctor's offices that we have today back in 1970. So I asked for clarification on that. Um, and then she says, I asked her what the specific wards were. I wasn't sure if they were the same as they are today. And reading down this list, it looks like it pretty much was the same then that it is now. So I asked about specific hospital wards, and she answered medical, surgical, obstetrics and gynecology, pediatrics, operating room, emergency room, orthopedics, same day surgery. And then I moved on to ask her how nurses were treated in the 70s. I know that in the 60s there was the whole, I think, well, I guess I don't know. I need to look that up, but I believe in the 60s at some point, right along with the um, civil rights movement, came a whole push towards feminism and, women being allowed to do more like they are now because, for a very, very long time, um, women were only allowed to be nurses or teachers. And so that's why I kind of wanted to find out if there was a problem with being professionally respected at work as a woman. And so she she said, I think she might have laughed when she looked at this and answered the question. She answered all my questions in print and sent them to me. Uh, she said, respect. There are many levels to this question. From management, is staffing at a proper ratio to provide safety for the patients? Are the nurses properly compensated by their salaries and their benefits? Is management supportive and do they listen to the problems of nurses? Doctors, do nurses and physicians work as a team? Fellow nurses, do nurses work together as a team? Sometimes they can be catty or gossipy. Patients, there can be a wide variety of responses. Fortunately, most are respectful and try to be compliant with their care plan. at that time. With my experience with my husband being in and out of the hospital a lot throughout our 28 years, uh, I have seen some some patients be awful. I really have seen patients just be abusive to a nurse. Thankfully, my big teddy bear husband, he when when he has to rely on other people to take care of him, it frustrates him because he's a man's man, and he can always take care of himself and everyone around him. And so when he gets laid out on his back, it's frustrating for him. But thankfully, in those situations, he's one of those patients who just becomes very grateful and appreciative of the help that is being given to him, which I'm very thankful for because I never have been very good at getting him to do anything he doesn't want to do. So I would have been useless in those situations if he decided to be a belligerent patient. And I'm very thankful to God that he never was. He just turns really, really sweet and grateful, and I'm thankful for that, even though it's horrible for him because he's always in pain when he's in the hospital. So anyway, side note, I digress. um, and so we had been talking about the patients, and she said, here are the potential problem patients: intoxicated from drugs or alcohol, mentally ill patients, drug seekers. We have those today. I had my own time in the ER within the last few years, and I thought I was having a heart attack, and so they rushed me back in, and I sat there and listened after they got us all calmed down. Like, I was not calm when I went in, and the staff was not calm when I presented with my symptoms. But I was just chilling out and cooling off and realizing I was going to be okay. And I was listening to this woman next to me in one of the emergency room cubicles or whatever you call it. And she was just flat out like, y'all know why I'm here. I just want that fentanyl. And I was just like, why are y'all even entertaining this? You need to tell her no and tell her to go on. I don't know. Maybe that was just my stressed out brain thinking. I don't know. But that's what we have today. Um, and apparently they had the same things back in the 70s. So back to the list. Um, Patients who believe hospitals should be run like a five-star hotel, they don't understand that sometimes they have to wait because someone has immediate health needs that require immediate attention. Yeah, the prima donnas that I think we all know of, if not personally know, at least one of those who wants to be treated like a princess when she goes up into the hospital. All right. And then she came back a few days later and added some more just kind of random notes, but I think they're interesting, so I'm going to go ahead and read them to you. She wanted to add, with the education components, I did not mention that upon graduation, nurses are required to take the state boards. I had guessed that, but I wasn't sure what it was called, and I think I may have asked that question in the first place. What did it take back then to, become a certified licensed nurse? And then she said, in order to become a registered nurse, an RN, the graduate nurse must successfully pass her state's written tests. Each state is in charge of their own tests and registration. License renewal requires fees and continuing education credits. And then she circles back to the charting because it must have been just a huge part of her daily life. When you're in the medical profession, it becomes your life. Is what I see from the outside looking in. I'm not in the medical profession. I could be at this point, but I'm not. Okay. So she comes back to charting. Charting is mandatory for all shifts. Accurate charting is mandatory and may be the subject of legal scrutiny if ever a case went to court. We are taught if it's not charted, it isn't done. Until recent years, most charting was handwritten. Now charting is done by use of computers. Um, I can imagine that must have been an arduous task and at each shift. You know, I don't know how many patients an average ward had in 1970, but now there's usually, I mean, I would say probably 50 or more on a ward. I don't know that. I'm just thinking of the times I've been walking through the halls to my husband's room, And so imagine doing that by hand for each patient. You know, each nurse is probably going to be assigned no less than 5, maybe 10 patients, depending upon how many are in the ward. And so you're doing that every single day, maybe even twice a shift. That's tough. I have broken my hand twice, my right hand, which is technically my writing hand with a pen. Uh, but my handwriting is so atrocious. It's entirely possible I was meant to be a left-handed person my whole life. My mom never corrected me. It just, I guess I saw my siblings writing with their right hands, and I just started doing it that way. I'm somewhat ambidextrous, so and I thought that was because I had broken my right hand twice at two different times in my life, and adapted and overcome. But I'm thinking that since I can do quite a bit with my left hand, I probably should have held my pencil in my left hand from the get-go. And now, at 47, it is way too late for me to switch. And again, I get off on a rabbit trail talking about charting, but I can only imagine how tough that must have been, especially, you know, once you were getting tired at the end of a long shift. And anyway, again, I really appreciate my aunt doing this for me, taking the time. I know that she has her own struggles with her hands too, uh, and I really, really just appreciate Aunt Patty. Thank you so much for taking the time to give me this beautiful response to my questions. Thank you. Um, you know, just kind of moving on, I guess. Talking about Peyton's Pride, the one that I'm writing right now. And I don't really want to, give too much of the book away because I really want y'all to go get it when it comes out later this year, hopefully. I think it'll be later this year. Um, you know, uh, with the nursing, it's kind of necessary for Elena to go and get her nursing degree because Adam ends up exiting the story for a little while, like 3 years. And in that time, Elena is taking care of his mother, who originally took care of Elena when Elena came to stay with the Peytons. Um, and so her getting her nursing degree really helped her take care of Mrs. Peyton's health problems. Y'all gotta read this book. It's gonna be a good one. And again, keep in mind, this is I hope, the one-off that will be a historical type. No, we're not going back to Little House on the Prairie days. But for me, this is a long ways in the past because I really love writing modern novels. I love the strength of modern women and the no holds barred for modern women. I love that girls can do anything now. And I just so I'm working on this this novel set in 1970 to 1973. I think will be the end of that. But it's tough for me to go that far back. I find myself trying to describe how Adam being a man at that time, how he might think about women. And I asked myself, well, would he really be that sensitive to her feelings? Um, because, guys now are more in tune to that stuff, but I don't know how it was then. Um, I know that my own parents were married in 1969, I believe, and um, my dad has some old school notions and opinions, which is natural and normal because he's from an era where, women were women. And they did things um, in feminine ways, and they didn't try to really, for the most part, in general, women didn't really try to break the mold that they were in. They were supposed to be helpmates for their husbands, and um, they were supposed to be good girls. So and then I don't really know, that point where women started to break away from just being, not just, that's not the right word, being stay-at-home mothers primarily, or nurses or teachers. Um, I I'm not sure where that line was where women started branching out and doing what they wanted. You know, I I was born in 1976, so I was kind of born at the tail end of that. And as I grew up, I started feeling like, well, if my brother can do it, I can do it. You know, um, or I would dare him to do things, which was always a mistake because he never turned down a dare. uh, just, I felt like I kind of was in the middle of that transition where women started going out and doing more things in the world. So anyway, that's I will be happy when this historical novel is complete. Just because I'm uncomfortable writing in that era. Um, before I'm even born. Like I'm uncomfortable with this, y'all. Uh, and I'm excited to move on to the story of Adam and Elena's eventual children that will come eventually, because Adam and Elena will eventually end up together. Um, so spoiler alert. um, I would just really so blessed with the people I'm reaching out to. I think I already mentioned this in the last episode, but I reach out to these random people. The Maine State Archives has been wildly helpful. The CHINFO, the and Chief of Information Office or something like that for the Navy. Um, just I'm doing a great deal of research, and I always do. I always research a lot when I'm, uh, writing a book. But this one has required research at every single turn. On on any given page, I've researched probably 10 things, just trying to make sure that I am not misrepresenting the era, the people of that time who, and I'm just trying to be accurate, like I keep saying. Uh, I I am I'm glad that I'm finally writing this book. This is a 25-year-old story. I got this first story when my own son was 3 years old. Um, and let's keep in mind I'm a grandmother 3 times over now. So uh, It's been brewing for a long, long time, and it's going to be a real relief to get it all on paper. I'm in chapter 10 right now. I'm moving towards the finale of the book, and I'm excited about it. I want to get off this podcast so I can go back to my writing today. I'm really thankful. God has just really helped me with some motivation. Um, you know, just just from the simple prompts. JD, you've waited long enough to write this story. Please get it done. You know, to being excited every morning when I get up to get to the computer and start writing again in the book. Um, I think that I hope that this motivation keeps going. Please, Lord. And uh, I'm looking forward to getting into the story of the girls because they're going to be pretty cool stories too. Um, I don't know if you've noticed, but I'm kind of a fan of my own writing. uh, if you're listening to this podcast, then I would imagine you might be a fan as well. And if you are not yet, I hope you will become one very soon. I do have a vendor market this Sunday in Seguin, Texas, which is a place that I spent 7 years of my youth, which was a huge chunk for me because, again, I'm from the United States of America. And if we're going to be technical, I've lived so many places in the U.S. and outside the U.S. too. So for me to spend 7 years in one place when I was growing up was just like monumental. We were always moving. And no, my dad was not in the military when I came around. He was an opportunist, I guess. If an opportunity came up, he snagged it and we rolled out. So I lived 11 months in one place, Oregon. Uh, that was fun. The mountains were our backyard, but that's the difference. 11 months was the shortest, and 7 years was the longest. I'm excited to kind of come full circle and go back to Seguin this weekend. It's the Yellow Rose Artisans Market. Um, and I'm looking forward to, you know, seeing the old town, showing my husband some of my old haunts, if they're still there. That was a long, long time ago. All right. Well, I'm going to wrap this up. I know I'm wandering around, but it's a good day, and I'm excited to go get writing. So, thank you for your time. Please remember to subscribe to my YouTube channel. We're trying to make our own momentum here, and just subscribing to my channel helps. Every little bit helps, and I appreciate y'all. All right. Be blessed. Love y'all. Bye.